Hi all, I'm Dr. R. Radhakrishnan, an assistant professor working in Essence College of Physiotherapy. And in the last video, we saw about the anatomy for abdominal wall anatomy for the physiotherapy students. For this, we saw about what are the structures underlying the abdominal wall, what are the boundaries of the anterior abdominal wall, topographical surface, topographical classification, and the abdominal regions divided into 9 parts. In this video, we are going to move further that what are the layers in the abdominal wall. The first one is the, as we saw already, the first one is the skin layer, second one is superficial fascia, fatty layer, it is also called as campus fascia. The third layer is the superficial fascia, membranous layer, Carpus fascia. The fourth layer is the external oblique muscle, and the fifth layer is the internal oblique muscle, and the sixth layer is the transverse abdominis muscle, and the last seventh layer is the transversalis fascia, and the eighth is the extraperitoneal fascia, and the ninth one is the parietal peritoneum. After cutting all these regions only, we can go inside the organs, we can operate the area where we want to do a surgery. The skins, as in this picture, shows that how we cut these regions loosely attached to the underlying structure, except the umbilicus. In the umbilicus, it is tightly attached. The umbilicus is a normal scar found by a remnant of the umbilical cord in the fetus. The largest line almost horizontally and forward and downwards. These structures are called the largest line in the abdomen. These are the structures we do surgeries. These are the structures we do the cuts inside this region. As we see that superficial fascia of Campbell, we already saw that it is the layer which is just above the fascia. It underlying this fascia, there consists of the fatty layer, campus fascia, and the membranous layer, scarpa fascia. There are two superficial fascias in our superficial fascia. Then continuity of the membranous layer of superficial fascia. There comes these regions. It is attached with the fascia lata, superficial perineal fascia, collis fascia. It attaches to the sciopubic rami. It continues into the dartos fascia, and then the external oblique and internal oblique aponeurosis. These are the fascia that is structure, that is continuity of the membranous layer of the superficial fascia. Then the external oblique muscle and the aponeurosis, we are coming to see that it originates from the 8 fleshy slips of the outer border of the lower 8 ribs, that is 5 to 12 ribs, and it directed downwards, forwards, and medially. It is inserted into the xiphoid, linea alba, pubic symphysis, and anterior third of the iliac crest. The nerve supply to this external oblique muscle is anterior rami of the spinal nerve T7 to T12. There are totally 5 muscles. These three flat muscles among these are external oblique, internal oblique, transversus abdominis, two vertical muscles called as rectus abdominis and abdominalis. Coming to see these muscles, there is an important and an interesting fact about this. The external oblique lies outside and the muscle itself is an oblique muscle. So it is called as external oblique, and the internal oblique is an internal oblique muscle in the abdomen. Coming to the transverse abdominis, this is the only muscle which is originated and inserted as a transverse muscle. All these muscles are originated and inserted from top to down or down to top. But this is the muscle originated sideways and inserted in the sideways. Two vertical muscles called rectus abdominis and pyramidalis. Rectus abdominis is the, as you know, the rectus abdominis is the, what is we say that six-pack muscle. You can see that on this picture. Then the external oblique aponeurosis. It's the structure of the external oblique aponeurosis. Below to this, the femoral artery and veins are passing through. It is attached with the surrounding structures. It forms the superficial inguinal ring. And then the internal oblique muscle and the aponeurosis. It is originated from the anterior two-third of the iliac crest, lateral two-third of the inguinal ligament, from the fascia and the and directed towards upward, forward, and medially inserted into the lower three ribs, xiphoid lineal bone, conjoint tendon. Nerve supply to this is lower sixth thoracic nerve, T7 to T12, first lumbar nerve L1. And then the transverse abdominis muscle, its organizations are given here, like with the originator from thoracolumbar fascia, iliac crest of the iliac crest, lateral one half of the inguinal ligament, the vascular cartilage is it, and it is directed transverse and it's inserted into the xiphoid process, linea alba, pubic crest, and the pecten pubis via conjoint and nerve supplies T6 to L1. In the next part of the video, we can go go through after what we are going to do in the surgeries, what are the surgical points in this abdominal region. Thank you.